Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your not-for-profit community-owned hospital. This program focuses on health issues relevant to you and provides information to questions you might have about different healthcare issues. My guest today is Brian Turney, the CEO of Kingman Regional, so I hope you'll stay tuned after these messages. We've got a great show for you. Welcome back to Your Health Matters. My guest today is Brian Turney, the CEO of Kingman Regional Medical Center. Thanks for being on the show, Brian.
Thank you for having me, Jamie.
We've got lots of things to talk about because KRMC has always got things going on, of course. But first, I want our audience to get to know you a little bit better because you've been at KRMC for, what, 20 years now?
Actually,
Over.
26.
26.
Yeah.
Oh, my goodness, sorry. But you've been CEO for
About 17 years. Yeah.
And before that, what did you do?
Actually, I started here as an administrative resident, came up from the Arizona State program and did a year here. And I was planning on coming here a year and leaving Kingman, and ended up getting hired as a personnel and the planning director, and then got into operations and eventually got hired as a CEO.
So you kind of learned your way up, and you learned it from the grits, you know, the whole thing.
Yeah, kind of grown up here.
And Kingman, of course, has changed a lot. Well, you've been here as well.
Yeah, I mean, the town's twice as big as it was when I came here. A lot of changes.
So you ended up, were you married when you moved here?
Just had been married about a year.
Okay, so your kids were born and raised here in Kingman too then?
Right, all but one.
All but one?
We had a 5-week-old when we moved here.
Oh, okay. So. Okay, so but she grew up here.
Yes. Yeah.
Very good. And KRMC, of course, has changed a lot. How many beds did we have when you first came?
I believe we had 84 beds when I moved to Kingman.
So it's changed quite a bit too, and you've kind of been at the helm of all that growth.
Well, part of it. It's quite honestly, it's what's kept me here, is the change and the growth. And
never a dull minute, that's for sure.
No. No.
Well, I know some of the things, of course, just recently with the new programs we've brought and the new physicians we've been recruiting. Our open heart program, for instance, that's a pretty big gift to the community.
Yeah, that's been a big step for us. It's a new program, but it's going well. Excited about it. I think we're getting close to our 100th open heart surgery.
Yes, I just heard 97, so we're 3 away from 100.
Yeah,
that's
so
amazing.
And
it's just been like a year.
Yeah, and Dr. Montero, who got trained at USC, he's been a great addition to our staff, and we have some good support staff, and we're really pleased with how the program's going.
Super. I know I'm very proud always. I tell people that all the time of the great things that I think we're doing here in Kingman for our community. Dr. Nagel with the Cancer Center is another new physician that we brought on, the oncologist. And
yeah, people love her.
Yes, she's a very caring person. You know, you can tell she cares about the whole person.
Yeah, we actually signed a contract with her almost a year ago, but we were so impressed with her that we were willing to kind of limp along with temporary physicians until she was ready to come
to make
and
that transition.
Make that transition. Yeah, and we're glad we waited.
Well, tell us about some of the other physicians that we brought recently.
Well, I guess one of the groups that comes to mind immediately is our radiology group. We now have 4 radiologists, all trained at Mayo Clinic, Rochester. Outstanding clinicians, and they're great people as well. They put the patient first, and from a CEO administrator perspective, you can just pinch me. I feel like I've died and gone to heaven. They're just outstanding, and
very caring individuals too, and they work together as a team.
Yeah,
and that team approach, and of course that kind of comes from the Mayo philosophy as well. That collaboration that Mayo is really founded on. Yeah,
they're really they have a system approach, and we like that, and they bring that with them, and just outstanding individuals and outstanding clinicians. And our medical staff as a whole is just, I've never got more compliments over the past 6 months to a year from our medical staff than the addition of these guys.
That's great. Well, because diagnostic obviously is kind of the first step in healthcare. You got to figure out what's wrong before you can fix them.
Yeah, and so much of medicine today is relying on that imaging part of the process.
And in talking with those doctors, I know that they also very much appreciate working for a healthcare like KRMC that has invested in the technology that provides them the tools they need to do their job, like the new tomosynthesis.
Yeah. I think that that when we were talking with them about coming to Kingman, there was, I think, two things that was attractive to them. One was the technology that was available, and our board had been real supportive of that over the years. And the other was the culture and where we were heading as an organization. That was really important to them as well. And I think those two things was enough for them to say, you know what,
want to be a part of that.
Want to be a part of that and be something, creating something. And it was exciting.
Well, not for profit. I think a lot of people have a misunderstanding of what that means. We run into that frequently. People, well, you obviously make money because you can continue to hire people and buy new equipment. So not for profit doesn't mean that we don't make money, but it does mean we reinvest. Right.
Yeah, I mean, the difference between not-for-profit or non-profit and for-profit, we don't have shareholders, people that invest in the facility itself. When we make money, and you do need to make money to continue to replace equipment and hire people and have reserves to make sure that the institution's viable, but all of that money is set aside for being reinvested back into the facility or into the people, whereas a for-profit has shareholders that they have an obligation to, and that's really the distinction between the two. And as a nonprofit, you have to do certain things. We have a robust charity care program and help people that can't pay. We have processes to help them with that, and so literally millions and millions that we give in free care each year, and that's part of that process of being a nonprofit institution as well.
And we're community owned and based. I mean, we really do care about Kingman because it's who we are.
Yeah, I mean, the facility is literally owned by the people of this area, and then the group that operates it are people that live in this area. To me, that's attractive. Quite honestly, that's one of the reasons I've stayed around.
And I think it's what brings a lot of the physicians and other healthcare professionals here, is that we do have that reinvesting back into either the facility or the community in one form or another. I know we've talked about how with all the access and Medicare cuts, and that does majorly obviously impact healthcare and us, because we have a big majority of our patients are affected by that.
Yeah, over 75% of our patients are either Medicare patients or Medicaid, which is in Arizona is called Access. So 3/4 of our patients are governmental payers.
Wow. And that's not dollar for dollar that they pay.
No, I mean, for example, with Access, we get paid about 16 cents on the dollar with that, and Medicare's about 1/4 for on the dollar. So it does create some challenges for us being in that type of payer mix.
Well, and one of the things that attracted me here too is the fact that KRMC also focuses on health and well-being. Our Deli Webb Wellness Center is a prime example of that, and our rehabilitation and getting people back into leading productive lives, whether it's the acute rehab, all of that. And I think you've had a good role in keeping that on track. You're physically active as well, and that's important, but keeping the hospital on that track.
Well, yeah, and I think that probably one of the most exciting things we did way back when, back I think it was 1999, was developing the wellness center, and then not just with the wellness center, but integrating our physical therapy and our other therapies with that. And we have people that come and they receive their physical therapy, and then the insurance says, you know what, we're not going to pay anymore, and maybe the person wants to continue doing some of the exercises or whatever they're doing, and they can get a medical membership, and we help them in many cases with that, to do that.
The foundation has a scholarship
program that supports them in doing that, and so they can transition on the same equipment around the same people, and just having that kind of integration has been really neat to see it happen the way it has.
Yeah. I'm really proud of it, and I know we were talking earlier about Dr. Nagel and the Cancer Center, and that was, I've shared with folks that was one of my first events that I did when I first came to work at KRMC. We did the ribbon cutting for the Cancer Center, and I remember thinking about what a gift that was for our community to have people be able to get their treatment right here in Kingman, instead of having to go to Phoenix and Vegas. And the same now with our Open Heart program. And what other kind of programs do you look at that we've brought here that helps people stay in town?
Well, I think that if you even go, for example, to the emergency room, for example, we have an arrangement with Mayo Clinic, which we call our Stroke Doc program, and having neurology support here has been a challenge in Kingman, and it's a challenge in a lot of rural communities. And we ended up working out a arrangement with Mayo Clinic where they have neurologists through telemedicine can communicate with our patients when they present to the ER. And they can literally talk to each other and see each other, and the doctor can do an assessment. And in stroke, many times if they've had the onset of the symptoms within 3 or 6 hours, a short window period, there's treatments they can do, clot busting type drugs that can help that patient. And if we didn't have that support from Mayo and having those neurologists, it wouldn't be safe to do that.
Wow.
So with that support, people literally can get those types of interventional type life-saving drugs that they wouldn't otherwise. So
Great.
those types of things, it's just neat to be able to be involved with that.
Yeah, be a part of that. Well, we're going to talk more. I know there's still lots more we have to share with the audience, but we've got to take a break, and so we'll be back. Stick around. We've got a second half coming up for you.